Hi, my name is Lindsay Petty. I'm here with Ashley Samuelinas and Gina Kim for our presentation on global health issue malnutrition for Nursing 500 Foundations of Health Equity, Transcultural Nursing. Malnutrition is the central to Sustainable Development Goal 2, which is zero hunger, which seeks to end hunger, achieve food security, improve nutrition, and promote sustainable agriculture by 2030. Sustainable Development Goal 2 recognizes that food security requires not only enough food, but food that is nutritious, affordable, and sustainably produced. Its key targets of ending hunger and all forms of malnutrition connect nutrition to human development and equity by reducing stunting, wasting, and micronutrient deficiencies, and by meeting the needs of vulnerable people. Persistent undernutrition reflects poverty, food insecurity, and weak agricultural systems, while overnutrition and nutrition deficiencies reveal food systems focused on quantity over quality. Ultimately, Sustainable Development Goal 2 and malnutrition are interdependent. Addressing the structural and social determinants of malnutrition, which are poverty, gender inequality, conflict, and climate change, is essential to realizing a world where people have access to safe and nutritious food year-round. Data
All
from,
right. Oh, sorry.
Go ahead.
Data from 2024 reveals the magnitude of the crisis. Approximately 150 million children under the age of 5 were stunted, and 43 million experienced wasting, and 35 million were overweight, which is considered to be a form of malnutrition, according to the World Health Organization, UNICEF, and the World Bank 2024. According to the Global Report on Food Crises, out of the 65 countries and or territories selected when they were doing their research, 295.3 million people, which is 22.6% of the analyzed population, face high levels of acute food insecurity, which means they face life-threatening hunger. According to the map, it highlights the number of people facing high levels of food insecurity in 2024. So this is on top of people who are already experiencing chronic food insecurity. While we often think of malnourished people as being thin, this isn't always the case, with malnutrition and obesity also presenting a significant concern. Among adults, about 2.5 billion people were overweight and 890 million were living with obesity, according to the Food and Agriculture Organization, or the FAO, 2024. Malnutrition contributes to nearly 45% of all child deaths worldwide. Next slide. So, according to the 2025 UN Sustainable Goals Report, despite some modest declines in hunger and food insecurity, the numbers remained higher than they were before the pandemic, with 8.2% of the global population facing hunger or not having enough food to meet daily energy needs. And approximately 28% experienced moderate or severe food insecurity, meaning they lacked regular access to safe, nutritious, and sufficient food. And that equates to 2.3 billion people. Then, according to UN Women, women and girls may be put in a position where they are first to eat less due to gender discrimination. This puts pregnant and lactating women at a significantly higher risk of anemia due to inadequate food and poor nutrition, with 35.5% of pregnant and lactating women worldwide suffering from anemia, which can impair birth outcomes, productivity, and cognition. And those cognitive effects in birth outcomes are obviously irreversible. Next slide. All right, so why is this a concern for the world? Beyond mortality, it can irreversibly impair cognitive development. It can reduce school performance, cause lifelong susceptibility to illness, and diminish workforce productivity over lifetimes, which can translate to large costs to individual people and national economies. So if you didn't care about just the moral and ethical implications, there's also uh, economic implications as well. According to an article by Sakshi et al. 2024 in the Journal on Health Policy and Systems Research, malnutrition in all forms is responsible for more ill health than any other issue, stating that costs are borne by individuals, families, and public sector and insurance systems, and that suboptimal physical growth causes lifelong susceptibility to illness, which again can lead to the lower labor productivity and absenteeism and lower lifetime earnings. Poor nutrition during child and adolescence in particular, again, can impair cognitive development, which then reduces attainment. So there are lost employment opportunities over a lifetime, thus perpetuating the cycles of poverty and inequality again across generations. According to Morales et al. 2024, reducing malnutrition and increasing health reduces global health threats by reducing disease, improving vaccine efficacy, and drug-resistant strains of disease. Next slide. So why should we care? And with hunger limiting human development, we will not be able to achieve the other sustainable development goals, such as education, health, and gender equality, according to the United Nations. We all want our families to be able to have enough safe, nutritious food to eat. So I think that that's really important. Next slide.
So, a global response in connection to malnutrition, the World Food Program tackles hunger driven by conflict, climate change, disasters, and inequality, as well as food loss. Its initiatives often include members of affected populations. One example is in collaboration with Egypt's Ministry of Social Solidarity, acronym MOSS, is the U.S. Agency for International Development, which is the USAID. The World Food Program supports the First 1,000 Days program, which is an initiative that trains community health workers to counsel and monitor pregnant mothers and nursing mothers during a critical period from conception to age 2 years old. This is a vital stage for preventing stunting and chronic malnutrition. The program also provides financial assistance through Egypt's Takeful and Karama initiative, reaching over 40,000 mothers and children under the age of 2, ensuring access to nutrition and health services during vulnerable times such as the COVID-19 pandemic. There's also the World Bank Group, which was founded in 1944. It's one of the world's largest sources of funding and technical support for developing countries. Through its 5 institutions, it works to reduce poverty and promote sustainable development, playing a major role in advancing Sustainable Development Goal 2. The World Bank Group invests in climate-smart agriculture, supports smallholder farms, promotes nutrition-sensitive agriculture, and strengthens food systems resilience through programs like Food Systems 2030. It also emphasizes gender equality and community leadership, recognizing women's essential role in global food production. Some examples of this are Ethiopia's Sustainable Land Management Project, which restores over 1 million hectares of land, improving smallholder yields and incomes. India's National Rural Livelihoods Project, which expands financial access and training for 9 million rural women. And then Latin America's Territorial Development Project, which advances archaeological farming and biodiversity protection. These efforts collectively link agricultural productivity, environmental and protective improvement, nutrition. And then last, we have the Global Agriculture and Food Program, which was established in 2010. It provides financing and technical assistance to strengthen agriculture and food systems to low-income countries. This is managed by World Bank and then partnered organizations. GAFSP funds projects that builds resilience, market access, and climate smart agriculture while prioritizing gender equality nutrition. It supports smallholder farms, producer organizations, and rural communities through grants, concessional loans, and blended finance mechanisms. As of 2024, this has financed over 320 projects in 55 countries, benefiting more than 16 million farmers worldwide. Together, these global efforts illustrate how coordinated international action linking agriculture, nutrition, and inequality drives progress towards ending hunger and achieving Sustainable Development Goal 2.
All right, so how have cultural insights informed this response? With broad global initiatives, it can be really difficult to address cultural diversity, leaving some nations grappling with how they're going to achieve meaningful implementation of these initiatives. While some success has been gained with agricultural considerations and improving regenerative agriculture and other farming practices to help improve malnutrition, issues surrounding women and in indigenous groups can sometimes fail to address complex interconnected factors. For example, the World Bank Group and the First 1000 Days program promote exclusive breastfeeding, and there are various cultural, sociological, and economic factors that can affect the translation of breastfeeding initiatives into practice. According to Oelana et al. 2021, herbal and medicinal preparations are commonly used among African people based on the beliefs that they ward off evil spirits and promote infant survival. To these people, feeding infants exclusively on breast milk is regarded as unrealistic and, further than that, a dangerous practice that puts infants at risk. Additionally, it's not easy to breastfeed at work, or refrigeration might be an issue, and other practical considerations. This is also part of why formula companies actively lobby against policies that support paid leave. So I think that this issue is really complex and really needs cultural consideration taken into account. Both women and Indigenous groups face challenges with UN representation as well. Only 13 of 193 UN member states had a woman as the head of the government in 2024, and UN rules state that primarily member states and non-governmental organizations with consultative status can interact with the UN, and Indigenous people are not considered NGOs or those non-governmental organizations. Ultimately, much could be done to implement culturally sensitive interventions into global planning on the Sustainable Health or Development Goals.
So we have identified the causes and the related social determinant of health to these issues of malnutrition. First is food insecurity, lack of consistent access to enough nutritious food, factors including poverty, poor distributions, lack of markets, economic barriers where people with low incomes have difficulty affording enough healthy food. Job loss is also a major drive of food insecurity. Unexpected expenses can make it impossible to pay for the nutritious food. For number two, it's poor dietary practices, lack of knowledge about the nutritional needs for different life stages, cultural preferences, and social norms can influence the dietary choices and practices that hinders the proper nutrition. Communication barriers where misunderstandings can arise from poor communications between the healthcare provider, nurses, and communities. This may prevent the effective health education and feeding practices. Number three, health issues, chronic diseases affecting the absorptions, where conditions like inflammatory bowel disease and ulcerative colitis can lead to reduced nutrition absorptions, and also like celiac disease, autoimmune disease like damages the small intestine in response to gluten, preventing the absorptions. Number four, environmental factors where nature disaster disrupting the food supply chains. Storms, flood can destroy roads, making difficult to just transport the food for vulnerable populations. And climate change, reduce agriculture productivity, extreme heat, floods can cause crop failure and degrade the soil quality. For the related social determinant of health, number one is economic stability, where low incomes limits food choices and access to the options and difficulty to find healthy alternatives. High living costs and low wage jobs can lead to food insecurity. Number two, education's limited resources, lack of access to reliable information through public health programs and providers, lack of knowledge about healthy eating habits. Malnutrition can hinder brain development also through inadequate intake of the essential nutrients during critical periods of early childhood. Deficiency in proteins, iron, and fatty acids can impair the formations and behavior deficits. For the community context, with strong support system can improve the food access. Cultural attitudes toward food can influence the dietary choices. And healthcare access, limited availability of the dietary counseling and support, lack of access to health services can lead to untreated health issues affecting the nutrition. Malabsorption syndrome, cancer can affect the absorption and appetite, but without the timely access to care, issues can go unaddressed and worsen the conditions of malnutrition. Next slide, please. So moving on to the next slide, we have determined what might be the impact on professional nursing, both locally and internationally. First off, with local impact, increased interventions where a rise in patients suffering from malnutrition-related conditions. This requires more comprehensive assessment and interventions. According to the National Institute of Health, patients with malnutrition have a higher rate of readmissions, with rates over 50% compared to those without the malnutrition. For education, nurses will need to educate more with patients and families about its importance and consider the cultural knowledge and preference. According to the National Library of Medicine, it is crucial where education must be patient-centered care, involving understanding that culture influences eating habits and food preparations. Resource allocations where healthcare facilities may need to prioritize resources and training programs. This is necessary for implementing successful preventions. And moving on to the international impact, cultural competence, where requires to understand different cultural perspectives on nutrition, on health that impact the patient care. This skills promotes the personalized treatment to align with the patient values and beliefs. Therefore, it is beneficial for our nurses to go through the transcultural nursing educations to provide culturally competent holistic care, which is crucial for addressing the malnutrition at all levels. Understanding cultural backgrounds helps nurses provide personalized care that considers beliefs and values regarding the food and health. And the research sharing potential for the international collaboration on the research regarding the best practice in addressing the malnutrition. This international collaboration can fill in the gaps in care and knowledge in the regions where these issues of malnutrition remain a significant challenge. For the global health initiatives, participate in international programs influencing the global health policies. This can involve the training staff, providing nutrition, education, and assisting with campaigns. For the Hunger Vital Signs, it's a screening tool that is used by the healthcare providers and organizations to identify the household at risk of food insecurity, hinders the physical and cognitive development, causing the cycles of poverty and illness that makes the communities more vulnerable. For the World Food Program, WFP is the humanitarian organizations implementing the school meal programs worldwide with over 50 years of experiences in this area. In 2024, the World Food Program delivered 2.5 metrics of tons of food, which strengthened the food and nutrition security and local economics around the world. Next slide, please. So here's are some collaborative opportunity exists locally to improve the population health related to the global health issues of malnutrition. First off, at schools, we're implementing nutrition education program, integrating lessons on healthy eating habits into the curriculums, such as using fruits and vegetables in math lessons or measuring the ingredients for recipes. For the food banks, access to the nutrition food for underserved populations, providing more nutrition food leading to the increased consumptions of fruit, vegetables, improving the overall diet quality. For the community garden, improving the food security and nutrition by providing fresh, healthy produce that may be unaffordable for the vulnerable populations. And Food is the Medicine program approaches the focus on access to diet and nutrition related sources, where it involves the partnerships between the healthcare systems, food banks, community organizations, and government agencies to address food insecurity and diet related chronic diseases. Next slide. So continuing from the previous slides, this opportunity for the collaborations to include the members of the population impacted by the global health issues of malnutrition. For the school, improve nutrition for disadvantaged children with benefits extending to better school enrollment and academic achievement. Food banks work with schools to fill in the gaps in school meal programs, helping to provide meals or other nutrition assistance to more children in need. For the community gardens, according to the National Library of Medicine's, garden provide gathering spaces for the community engagement, providing the social connections and sense of community across the different socioeconomics and cultural groups. And last, Food is a Medicine program, according to the Center for the Nutrition and Health Impact article, individuals with chronic illnesses and food insecurity are the primary members of this Food is Medicine program here. Next slide, please. So for this slide, we wanted to share more interesting insights we have found where instead of malnutrition, there were some factors of driving obesity in poorer countries. So according to the World Health Organization's, processed foods are often the cheapest way to get calories. Globally, these billions of people cannot afford a healthy diet, leading them to rely on the low-cost, energy-dense foods that are high in fat, sugar, and salt. The food system has expanded the productions of processed shelf-stable foods. These products are highly addictive, contributing to overconsumptions, and also the targeted marketing, where fast food and beverage companies market their products to emerging economies in Asia, Africa, and Latin America. Next slide, please.
So in order to kind of bring all of this stuff together, we've put together a case study. So meet the Ramirez family. They live in a small rural town in southern Texas near the U.S.-Mexico border. Juan and Elena Ramirez are parents to 3 children. Luis is 7, Sophia is 4, and Mateo is 18 months. Juan works seasonally in agriculture, and Elena stays home with the children. The family combined income falls below the federal poverty level, and they rely on small SNAP benefits to buy groceries each month. Recently, Mateo, the youngest child, was seen at a well-child visit. The nurse noticed that Mateo's weight for his age was below normal limits. A screening tool using the hunger vital signs revealed that the family frequently runs out of food before the end of the month. Elena explains that their grocery store is over 25 miles away, and transportation is unreliable. When money is tight, the family relies on inexpensive, calorie-dense foods like ramen noodles, chips, and soda. The nurse initiated a referral to the WIC clinic for supplemental nutrition support and connected the family with Food is Medicine program at the Community Health Center. This program provides vouchers for fresh from produce and offers monthly nutrition education classes in both English and Spanish. During these sessions, nurses and dietitians demonstrate simple, affordable meal plans using culturally familiar foods such as beans, rice, eggs, and local vegetables. Elaine, however, reports challenges in consistently attending the classes due to lack of childcare and Juan's unpredictable work schedule. Although the family is gradually incorporating more balanced meals, barriers such as transportation, financial strain, and limited health literacy persist. The nurse recognizes that broader social determinants of health, like poverty, geographic isolation, and structural inequalities in food distribution, continue to influence the family's ability to maintain food security. So for a class discussion, we have a few questions we would like to address with the class. The first one is, what additional nursing interventions or community partnerships could help address the Ramirez's family barriers to nutrition and food security? Two, how can transportation, language, and income barriers contribute to malnutrition and food insecurity in rural U.S. communities? And three, how can nurses use their role in clinical and community settings to advocate for policies that align with SDG 2 and support equitable access to nutritious foods? So, for our conclusion, malnutrition continues to be one of the world's most crucial global health concerns affecting billions of people across all regions. It is both a cause and a consequence of poverty, conflict, and inequality. Sustainable Development Goal 2 offers a blueprint for eliminating hunger through integrated strategies that combine food security, health equality, and sustainable agriculture. And here are our references for our presentation.
And thank you for watching.
Thank you.
Thank you.